Can they go in the building? Yeah?
Just days before Christmas, Jillian Curtis's 5-year-old son tested positive for COVID-19. The positive test made the Fuquay-Varina mother worried about the risk to her family over the holidays.
It's just all of the unknowns were what the major anxiety was. We didn't know.
The Curtis family believes Cohen was exposed to the virus at his preschool. The 5-year-old wasn't showing any symptoms, and Jillian and her husband both tested negative.
I almost didn't believe it at first because he really did seem okay. And then that made you wonder, how susceptible we were to it, if he's not showing symptoms. Also, him and his little brother share a room, so, do you split them up?
The other challenge Curtis faced was how to explain all of it to Cohen in terms that he could understand.
We just told him, you know what, you have germs right now. We have to take a break and stay in our house, and we'll have fun here. And, your grandparents can come after we make sure that our germs are gone and we've cleaned our house. So just try to use terms that he understood and not make him feel like it was his fault.
Any of those patients on the high side going to be able to leave today? Are they
For Benny Joyner at UNC Children's Hospital, he says most kids who test positive for COVID-19 are like Cohen and suffer very mild or no symptoms at all. But there are some children who experience complications, and the challenge is how to keep families close yet safe during their hospital stay.
Part of our creative strategy is allowing family members to be in the room. They've already been exposed, but they can't leave the room. That's been a challenge, understandably, but a lot of parents have appreciated the opportunity to be in the rooms with their child, and so I think that's been the biggest thing for us.
Joyner says creating a pediatric response plan rests not on just medical treatment, but the unique needs of its young patients.
One of the things that we found was that it provided a lot of reassurance for this anxious child already because he could be there with his mom. I couldn't even imagine providing care to this, alert, cogent child without having, a mom there to be able to help us calm him down.
For Jillian Curtis, she says she's fortunate that her family survived their COVID scare without a trip to the hospital. But it's opened her eyes to the seriousness of this virus, and she's eager for the vaccine to become more readily available.
I try to think about what can I do that's in my circle of control that can keep my family healthy and safe, and then other than that, we just take it one day at a time.